Namaste, everybody.
Namaste.
Can you hear me well?
Yes.
Yes. Okay. So I think just like our last webinar, we have three very esteemed doctors with us. And I'm first going to introduce them, and then we can start off with some questions that people might have. So first we have Dr. Samiksha Meal. She is a pediatrician and her office is in Methuen, Massachusetts. She's also a clinical associate for the Boston Children's Hospital. And she, she has been involved with the HSS for a very long time now. We also have Dr. Shubhadaji Zawalekar. She originally hails from Indore and stays in Westboro with her husband Dhananjay Zawalekar. They have two daughters, Ashwini and Priyanka. Ashwini is doing her residency in Albany, and Priyanka is working as a financial analyst in New York City. Dr. Zawalekar has practiced medicine in the US for more than 25 years currently, and she leads a team of internal medicine physicians at the St. Vincent Hospital. Dr. Zawalekar, as I mentioned earlier, also has participated in our last webinar, and she actively supports Shaka activities, HSS activities in a variety of ways. And then we have Dr. Sureshji Mamidala, who hails from Warangal in India, which is in present-day Telangana. He lives in Shrewsbury with his wife, Dr. Kavitaji Mamidala, and two kids, Anika and Teja. Dr. Mamidala has more than 20 years of experience as a physician, first in Guyana and then in the US. He came to New York and then to Massachusetts, where he currently practices as an internist and actually treats COVID-19 patients. And they are also very actively involved in HSS. So I think with that, we could begin, our conversation. I think for those who arrived a little bit late, I will just go over some of the things we went over. I think, including me, all of the three doctors we have taken the COVID vaccine. So it will be also much more of a first-hand information about how the vaccine works and stuff like that. So let's start with their personal experiences. Maybe we can, I'll start with Samiksha ji. Samiksha ji, you can go ahead.
So personally talking, like I took my COVID vaccine almost 4 weeks back, because tomorrow will be my second shot. The first shot was taken 4 weeks ago, which was Moderna vaccine. The following day, that's the second day, I got sore arm. That's all. Sore arm means, you felt heavy in the arm, or thoda dard tha. Like when you lift it like that, you feel little heavy. That's the only symptom I got. My husband had taken the vaccine too. He didn't get any symptoms, not at all, not even the heavy arm. Some people in the office, they took the vaccine, and I checked with them what happened. One of the girl got again a heavy arm, and the other two did not get anything. Some of the friends I checked, and some of them after the second shot, they have reported that they got little more symptoms like body aches that day. They got tummy upset, so probably they went to the toilet more, and maybe headache they reported. And within 2 to 3 days, it was all resolved, and all this usually took place on the second day and after the second vaccine.
So that everybody knows, Samiksha ji, what vaccine did you take?
I personally got Moderna.
Okay.
And usually the people who, like, I am one of the persons who, even within the doctors, there are like high risk doctors and then the second level doctors. I don't fall in the very high risk of doctors. The doctors who really work, probably like Dr. Suresh, the ones who go to the hospitals and they see patients in beds, they are the first ones. So Pfizer had come first, so those people are getting Pfizer. And people like us who are in the second rounds, we get Moderna.
Okay. So we can potentially ask Dr. Shubhadaji if you can relate your personal experiences of taking the vaccine. I think you're muted. Shubhadaji, you're muted. I think you need to unmute.
Okay, looks like now I'm unmuted.
Yes.
Yeah, so, I received Pfizer, and our hospital, the same thing, first phase, like Dr. Mamidala must have received that kind of group of physicians, and then more in the outpatient setting that we are. I received my first one in somewhere in the last week of December. And after the first one, when I got the shot, I did not have any pain, no, nothing. I was so happy that nothing happened. But when I reached home, I started feeling a little dizzy. So that was after like maybe 45 minutes or so, and then very fatigued. So following day, I just kind of took rest. It was my day off, so it was fine. So I was all prepared to kind of get similar reaction after I had my second shot, like 21 days after. Um, that day for 24 hours, nothing happened. Minimal pain, really not really much pain on the arm where I received it. However, after 24 hours, I had chills and body ache that lasted for probably about like 12 hours. I ended up taking Tylenol and just some rest, and that was that. And how Samik Shabji was saying, some people are having reactions, some not. In our office, there are 3 providers and about like 20 of the ancillary staff. I believe except 2, everybody had the vaccine by this time, and some of them didn't have any reaction. Some had maybe just a little bit of body ache. One person had some left-sided facial tingling numbness that lasted probably for half a day, and then it resolved. So I think that was something new that to share here, that some people have experienced that. But pretty much that's where most of it is.
By and large, pretty much not much of a
no
adverse effects. Yeah,
seen so far. Yeah.
Okay. And I think I would then ask Dr. Sureshji to kind of share his experience. He's the front line also. So if you can share what your experience has been. You are muted, I think, yes.
Okay, yeah, I think the host muted me. Yeah, I received my first shot of my Pfizer vaccine on the day one when they enrolled it. And the second dose, I got it on Jan 6th. I didn't notice much side effects except for some pain at the injection site. The first one was a little bit more than the second one. I used some ice pack briefly for 5-10 minutes, and I felt well after that. And I was working throughout. I didn't notice any other changes. Even in the hospital, I didn't hear any major adverse reactions so far.
All right. Okay. So there is one question that says that can you take the first and second shots be different from? Does it have to be from the same company or can it be different? I would assume it has to be same, but I'll let you really elaborate on that.
So preferably you want to have the same company. So if you have Pfizer, then you get another one after 21 days. Or if you have Moderna, then you get after 28 days. However, if there are some kind of extenuating circumstances that the second one is not available of the same company, you can take it after 28 days. That's what the information is available at this time. Would it change?
Okay.
Maybe. And up to 6 weeks, you can get it if it's not at all possible to get it sooner.
I see. Okay.
But usually once you receive the first dose, they will give you an appointment for the second dose.
Right.
Yeah.
Yeah, that's true. Yeah. So because when I took the vaccine, I did get a bit of a pain on my arm, but it lasted for a couple of days actually. And the first day I felt a little too tired. I had to go back to sleep by 8. 8 p.m. because I was just feeling very tired. But anyway, I've been scheduled for the second one, so we'll see. I took the Moderna one. So the next question is can a person spread the virus after getting vaccinated? Suresh, do you want to speak on that?
The answer is big no, actually. Yeah, it's not going to get into your nucleus. So even the test won't come back positive. You won't get infected with the coronavirus by vaccination.
And you cannot spread it also to other people.
Yeah.
I think his question was, if you take the vaccine after that, will you spread it? Are you still a spreader? That's what he's asking.
Yeah, that's what.
So
yes,
after you have taken the vaccine, you can still be a spreader, but because you can be carrying it in your nasopharynx. And that's why the rule of the game is that till as much as possible people get their vaccines, maximum population gets vaccinated, we can still be spreading. That's why we are supposed to still continue to cover our noses, our mouths, so that we do not spread it.
Is the evidence clear on that? Because I feel somehow that, yes, I agree that if you have it in the nose, you might be able to spread.
See, this is the point. We will develop the antibodies. We will, like if I have taken the vaccine, I have built up my antibodies. The virus may come to my body, but I will not get as sick because I have antibodies inside me to push it back. But maybe the germ is still sitting on me. So say you come to me, and if I cough and if I sneeze or in the aerosols, I can still be the spreader. So the idea is that you have to cover yourself still for a couple of months till CDC or the government finally declares that, okay, the disease is under control. And what are the markers for control? Hospitalizations have to go down, sick people numbers have to go down. That's how CDC is going to measure that, okay, the disease has come under control.
Okay.
So the vaccine does not prevent the infection. So the infection still can happen. And that's why it's important that how, after getting vaccination, we are going to have the immunity to fight the vaccine. Fight the virus, but it's not going to prevent the infection. And that's why the asymptomatic carrier state could be there. And we cannot lax using the mask, hygiene, and social distancing has to be maintained till we reach the herd immunity or any changes that would be recommended by CDC.
So the other question is, after taking those 2 shots, will we be out of danger from the different variants that we are hearing about from UK and South Africa and other places? Anybody can take that. Sureshji.
So,
yeah.
Yeah,
go ahead.
We do not have enough data to.
Go ahead.
Yeah, we do not have enough data to answer that, but they are saying by extrapolating the other things, they're saying it's safe so far, at least for the UK variant, but they're not sure about from the South Africa variant though.
One of the things that came along is Pfizer and Moderna. They have already been out. Johnson & Johnson is still under development. So there are chances that kind of might get tweaked a little bit to get better coverage for other variants. But I believe Anthony Fauci was claiming that UK one is covered with what we have currently.
Right. I think they tested it in at least efficacy that it might work against that. Okay, I think we are getting a good number of questions. So another one is there any evidence about how India has flattened the curve without vaccination while the US has not?
That's a very good question. I think probably multiple factors, I assume. One thing is we have like a most younger population compared to the US. And the other thing that talking about is there's some kind of a cross immunity from other coronaviruses that might be helping the people in India. And
Right.
there are some reports that the BCG vaccine might be build up some immunity towards it. Yeah, nobody has
Yeah.
answer for that.
Well, I think there was a recent paper, Nature paper published. There was a recent Nature paper published saying that most places in South Asia potentially, probably had uh, uh, got exposed to a good amount of the population, potentially got exposed to some other form of coronavirus, and that's why they're having a lot of
Yeah, that's,
asymptomatic people as well as But
I
anyway,
mean, yeah.
yep.
Yeah,
Go ahead.
they are saying that maybe there have been clinical and subclinical cases, and how you mentioned that a lot of younger population. So have we reached possibly herd immunity? We are not quite sure, but that is another postulate being floated.
Yeah. So I guess one question that probably needs a little bit more clarification is, after the 2 COVID vaccine shots, will you be immune to COVID-19, and will all be will be safe from serious danger? I believe the answer is yes, but I'll ask one of you to answer that, uh, whether we'll be immune to COVID-19 and whether we'll be out of danger or serious danger.
So whether we'll be immune to COVID-19, so far, though it's evolving, nothing can be said 100% because these vaccines have come new. However, it's expected that, okay, 6 months immunity we will have, because whatever antibodies were built up, whatever these scientists studied, they saw that probably these antibodies are going to last through 6 months. So that is one thing. Nothing can be said that, okay, you'll be protected now for next 3 years or 2 years, or we are done forever. But 6 months kind of guarantee the vaccines are taking. That was one part of your question. Second part, I don't know what you said, Yogeshji.
um, I think basically whether you'll be out of serious danger.
Serious danger, yes, definitely, because think about it, like when you get the vaccine, you build up little soldiers against that disease. You have soldiers standing in your body already. Now again, when the virus comes, they fight it back, so you get a less severe disease. So
Yeah.
you go away with milder symptoms even if you get diseased. So yes, it does protect. That's why older people are getting it mainly, and sick people are there in the first in the list.
Okay, so I think following up on that, I have another question. Um, do we know how to get registered for senior citizens? Because now they have opened up, for administering the vaccine for senior citizens. So do we know how to go about doing it?
Yes, you should go on the site. It's called mass.gov/covid-vax. Okay. And then they have just yesterday floated out, trust the facts, get the wax. On that site, if you go, you can register there. You have to just read through it. mass.gov/covid-vax.
Yeah.
So just write down mass.gov.
Yeah, I put it in the chat window.
Yeah.
I put it.
And there is another number 211 that is recently started from Monday through Friday from 8:30 till 5 o'clock. Anybody 75 and above can call 211, and that helps you get registration done.
Okay, that's great information. Another question is, how safe is it to travel to India after getting the vaccine?
Yes, definitely you are in a better status after you have taken vaccine. You're much better than when you had not taken the vaccine. So keeping all precautions, again, with mask and social distancing, keeping hands clean, you're vaccinated, you are safer. But remember, the antibodies also take time to build up. Like today, when you get the vaccine, you're not protected tomorrow. You're protected after 4 weeks. That's how the body works. So if you have older parents and if they're scheduled to go, if it's not an emergency, keep them for 4 weeks before they travel.
Okay.
And one more important thing, when you asked about the vaccine, that how do you register. One more thing I want to let you know, anybody can go and get it. Anybody who is today in Massachusetts, you don't have to be a citizen or a green card holder. Even your visitor parents can go and get it.
Okay, but that's still only
Yeah,
senior
sure.
citizens.
Yeah.
Yes, they have that scale. They have written.
Yeah, when you go on the site, I think they show you the eligibility and like
Okay.
which phase is going. That's how it's kind of currently going. It could change.
Okay, so Shubhadaji, any idea on when the younger population, so the rest of the people, will be starting to get this vaccine?
I think currently looks to be around like April, late March, April is the slated
I
time.
see. Okay.
That's what looks like on the .gov messages.
So for our children, 16 years and older children who have any kind of high risk condition, like if they are type 1 diabetes, if they are asthmatics, we can get them the Pfizer vaccine, 16 and above. We are supposed to send those lists to Boston Children's Hospital and they get the vaccine, 16 and above.
So given, I'll continue follow up on that. Let's say right now with the senior citizens, what precautions should we take? What kind of pre-existing conditions people with those conditions should avoid taking the vaccine, or something like that? Is there anything out there that says, okay, if you have these kind of allergies before, or if you had this kind of conditions before, don't take this vaccine?
There's no contraindications for vaccine itself.
Okay.
Unless one has any history of allergies, you can still take it, but just inform your physician. You can still get it though. But if there is some kind of history of anaphylaxis, then they should be careful. Still, it's not contraindicated. You should talk to your doctor.
Okay.
It should be like an informed consent. Otherwise, there's no contraindications. There's so many people enrolled with a history of allergies to sulfur, eggs, some pets, and all the common allergies, and they took it and it's been safe.
Okay, that's great to know. What kind of, so one of the other questions that I saw was that some people recommending taking taking some kind of medication like a Tylenol or a ibuprofen before they take the vaccine. I presume that this is probably not standard. So what are your thoughts, whether they should do it, not do it, because in anticipation of the pain or whatever?
At this point of time, the CDC is recommending not to take any medications before the vaccine. But after you take the vaccine, if you have some kind of symptoms, you can use the Tylenol, ibuprofen, something like that, for some symptoms of muscle aches or body pains or fever. But before, to prevent it, they're saying no, not use it, because we still don't know how it's going to affect one's response to the vaccine, your antibody buildup.
Right. So don't take any medicine before going. Okay. Okay. And so other question is it likely that this will be our next annual flu vaccine? Is COVID going to be an annual COVID vaccine now, apart from a flu vaccine that some of us get?
I don't think we know the answer for that, because post licensure studies will be going on to see how the antibodies levels are, and at some point we'll have to figure out whether it will be annually revaccination needed or not. I don't think we have definite answer yet.
Right. And how the virus itself evolves, so the medication probably.
Yeah, if there is any mutation or not, which we are already seeing some of the questions being raised. So time will tell.
Yeah. Are there specific resources or places that people can go to figure out, this is the place we should find more about, if they want to read more about the vaccine?
And they
So,
can go, okay, yeah, go ahead. Yeah.
CDC, you know, you always read CDC. Then there is MMWR, which is um, Mortality Morbidity Weekly Report, MMWR, but nobody really goes to that one. So CDC is the best one. Just go there. They write it very easy, layman's language, and just that's sufficient. Even we literally go there and we also read there. Shubdaji, you can add.
Yeah, I think, I ended up going on one of the sites on Mayo Clinic, and they had very comprehensive, common questions answered. So that might be helpful as well.
So there's another very good question. So let's say after first or second shot, you get very painful effects. Should you go then back and approach your physician, doctor, or the hospital? What should you do basically?
You should always call up your doctor because you don't know when you're entering into anaphylaxis. Remember, if you start getting breathing difficulty, that's the worst thing. Okay, so immediately call your doctor for breathing difficulty, or say you have severe reactions, the whole face goes red or the skin goes red. That's second. And the third is if you have fevers more than 1 or 2, do call up your doctor, because you would not know where am I. Like, okay, I can understand that this was not worth a call, but I don't know if you're sitting around inside your house with something bigger. So if you feel, blasting headache or something, call. Why do you hesitate? Call your doctor. So what? They will just hear. I get calls all the time, and I just hear some, nothing severe. Okay, I just convince them. What's bad about it? Reach out to your
Anything?
doctor.
Yeah. Anything else?
But right now the standard of care is they're observing you for 15 to 30 minutes after each dose.
Right.
After you get the shot, you have to sit and wait in the clinic itself for 15 to 30 minutes to develop. They'll monitor you if you develop any immediate reactions to the vaccine.
I mean, a lot of reactions, there could be like 3 kinds of reaction. One thing is the allergic reaction to the medication. Another one would be, sometimes just the anxiety of getting something new causes like feeling dizzy, sweaty, and all that. And, if you're waiting there for 15 minutes, 30 minutes, that will pass. So we know that that is not allergic reaction, but more what we call vasovagal reaction. And then a lot of allergic reaction, like delayed reaction, that how I had like after 24 hours, body ache and all that. So that would be anticipated probably from 1 to 3 days after the vaccination. That would be more related to the vaccine itself. So that might help kind of, just divide into like immediate, or is it like just the anxiety related, or it's actually vaccine related.
Okay. The other question is, many people, especially the elderly, would take some of their medications like blood thinners or other medications. So is there anything they should do? Like, okay, should they keep on doing the regular routine, or they should not take some of their blood thinners before taking the vaccine or anything like that? Any sort of guidance there, or is this just regular day?
So there is no contraindication for blood thinners. If they are taking the newer kind of blood thinners like Xarelto, Apaxaban, and all that, there is no contraindication at all. Or if they are on Lovenox kind of injectables, no contraindication. As far as somebody who's on warfarin, they do recommend that have your INR in the therapeutic level. And it might be a good idea to get it checked after you have vaccine.
What about steroids and immunomodulators? What would you say about that?
No, you can use them. Yeah, if you have to use them, there's no contraindication so far. It's not a live vaccine. So still they're recommending even for the immunosuppressed patients, they can take the vaccines.
And they can take the steroids and immune modulators at the same time?
Okay. Okay, so I think a lot of the questions have been answered. Are there any other specific things that people would want to know? Looks like we've covered most of them. So I guess so as far as children go, we for now know that they will not be getting vaccinations, right?
Yeah, the studies are going on. They are just like in our adults, we were injected the phase 3 trials. Same way they have enrolled children from the age of 12 through 18, and those studies are going on. Where I had read once upon a time, today I've forgotten where, and they are injecting, and they are saying that by April they will have more clarification if they should include children and from what age. But the good news is so far that all the small children who got infected with COVID, they never got severe disease. They got mild symptoms. They were all right within 2 to 3 days. So let's see what the government comes out with, what policy it comes out with, because usually who's given vaccines? The vulnerable population is given vaccines. So maybe they come with rules that, hey, such small children, no need of any vaccination for them. Let's
I
see.
think UMass is doing some enrollment for the younger children if anybody's interested. I don't know whether I have that site with me, but UMass is doing some enrollment for younger children.
This is for the clinical trial, you mean?
Yeah.
Clinical trial.
Okay. So in case, so
and
I guess yes.
one more thing I want to tell you all, that if anybody has a child who gets COVID and who's small, that means less than the age of 16, and he starts to get symptoms, and he's a high risk child. High risk means any kind of comorbidity. Again, Boston Children's Hospital is again giving the infliximab, those kind of things. They have that, and they are saying that send us those kids, because that way the disease will be milder on the child. So they'll admit him for 3 hours, 1 hour they do the infusion, and then they let you out.
Okay, so that's very good to know. So in case, yeah,
because
high risk
I remember
children.
1 or 2 of our children are high risk in our circles.
Yeah.
So
okay, that's
it's information for those children.
Right. That's very important to know. So the other question is, will consumers have a choice to which brand or which company vaccine they could choose? And if so, any recommendation from you, whether they should prefer Pfizer or Moderna? I think I'm not sure if the one from Oxford AstraZeneca is going to come on board or not, or when is it coming? And yeah, anybody could take that. Yeah.
So
yeah,
I think
ahead.
all these vaccines, now we have the Johnson & Johnson coming up in the running as well. So long as we are getting adequate efficacy, Pfizer and Moderna, they are saying 95 and 94.1 respectively. And Johnson & Johnson is saying, I think, something like 64%. However, when they looked at the mortality after getting the shot, in the severe cases, it was down by like 85%. So looks to be they're kind of going to be comparable eventually. Some of the things that are kind of interesting, because Moderna and AstraZeneca, there are 2 vaccines, one after another involved. So the production wise, availability, would that be any issue? While Johnson & Johnson, it comes in the market, it's only 1 shot. Would that make availability kind of number wise more compared to the other 2? That would be interesting to see how mass production gets affected or not. Another one, just because of the logistics of keeping it at a very cold temperature, Pfizer and Moderna can stay at a refrigerator temperature, but it doesn't look to be Johnson & Johnson has that restriction. So kind of, comparing all this more production and availability issue, would that give broader option to the consumer or not? That would need to be seen.
Okay. The other question is, what do you have to say to people who are a bit nervous or reluctant to get the vaccine? I think
So,
each of you can put in
yeah.
some. Yeah.
So first of all, ask your own self, like, what makes you question you should not take the vaccine? Bring up that question. What are your inhibitions about not taking the vaccine? The second point, if you're thinking that this is mRNA and it's going to change my DNA, so mRNA never enters the nucleus of the cell.
Cells.
It stays outside in the cytoplasm, and your inside is the DNA. So be clear that it doesn't go there. And then by now, so many thousand people have taken the vaccine. So why are you hesitant if you are hesitant? And the last point is that infectious disease all around the world has been brought under so much control. Polio has been wiped out. Measles, people used to get the measles and it used to go in the head, and people used to die of meningitis. So scientists and science has done a wonderful job with infectious disease. So take the advice of the scientists and science. um, a policeman does not know science, which is fine, and a doctor doesn't know how law works. So let's not interfere in each other's areas, and take the good advice from the others.
You want to add anything, Shubhada ji and Suresh ji?
So one of the things, I was talking to one of my patients, and we were kind of going along talking like, would you be in favor of it or not favor of it? One person had obviously concerns about, the newness of the vaccine with mRNA, and educating them would have been kind of, some way to kind of go. But another person who said that, oh yes, I'm going to get it because I have seen people dying from it, and I do not want to be on ventilator. So it's kind of interesting to see, some people, how when they watch TV or the news, what kind of things they kind of perceive, and they are kind of willing to go ahead compared to other people who might be more afraid because of the lack of information available. For me, keeping the faith in the scientific community, it was the way to go for and get the vaccine. There was no question for me, but I have seen different kind of responses from patients. And as we are going more along with it, I think there is more openness and increasing acceptability for it.
Okay, Suresh ji, any other thoughts?
I'll tell you, these both Moderna and Pfizer, they were studied in US population. Most of the population are US. Pfizer is enrolled like a 45,000 and Moderna is like a 30,000. Most of them are like a white Americans. In Pfizer, there's like a 6% are Asian, Moderna is 4% is Asian. And when you're taking the vaccine, I'm sure you're concerned about the side effects, right? The major side effects are like a headache and fatigue. There's reportedly like around 50%. The other one is like a fever and some body aches and joint pains. So all these white people, they complained of some headache and fatigue, 50%. If you look at the placebo group, 25% of them complained the same thing. Okay, that's very interesting. So it's very subjective. Okay, if you do the same, go and do the same study in India, I'm sure that number will be down to like a 10 to 15, just because of a threshold to the pain and about the complaint, all these things.
Okay. So there is another interesting question. So what if I had COVID without symptoms? Should I take a vaccine? Or even, yeah, let's get this question first. If I had COVID but no symptoms, should I get the vaccine?
So it depends how long ago was the COVID, because the person has to be completely out of the quarantine, and after that they can take the vaccine. Do they really need to rush to get the vaccine? Probably not, because they have developed some immunity with the antibodies, so they don't have to rush it. They can probably wait up to maybe even 90 days, but they should get it. I mean, I have had a couple of patients who actually got first COVID vaccine, and after 2-3 days, they developed fever, body ache. They ended up getting tested, and they had COVID. So they did not get the COVID because of the vaccine, but probably, they had asymptomatic exposure earlier and then they developed it. So after their symptoms were gone, they got the second vaccine as well. So even if you have developed COVID in between the two vaccines, that does not mean that you cannot get the second vaccine either.
Okay, and the other question is, what if you don't know that you have COVID and then you go to get the vaccine? More or less what you exactly mentioned just now, Shubhadaji, is what happens then? That's one of the
आप ही आंसर
questions.
करो शुभदा जी, आप ही बताओ.
Go ahead, what is that?
You only go ahead.
Oh yeah, no, I think, if it is asymptomatic again, and if you have received the vaccine, question is like, how, the vaccine is probably going to go ahead and forward the development of the antibodies and protect in future. But if you're already had it for 2-3 days, I don't think there is going to be any major adverse reaction at that point.
Mm-hmm.
If the patient develops any kind of reaction, should definitely outreach to his or her physician to find out what might be. But I don't think that there would be any particular contraindication at that point, because you had the infection and you already received the vaccine. I don't think that would cause any adversity.
Anything else you want to add?
And
Yes.
yeah, I want to add, Yogesh,
Yes,
any pregnant women, and if the COVID vaccine is around, there's no contraindication so far that in pregnancy you can't take COVID vaccine. Go ahead and take your vaccine, whether it's first trimester, second trimester, or third trimester. There's no contraindication. And the second is, if a lady is lactating, that means she's breastfeeding her baby and she has to take the vaccine because they are health workers or something, go ahead, take the vaccine. You can continue to breastfeed the babies.
So the other question, Samisha ji, is, has there been enough data and study for pregnant women?
No data, but the way the vaccine is, the way it's constructed, and extrapolating from the other vaccines that are given to pregnant women, it is considered that so far it's safe. What is it going to do? It's just going to do antibody production. Is it going to do teratogenicity? No, unlikely. Because the women who got COVID infection also, and then they have delivered babies, so far we have had all normal, healthy babies, no dysmorphologies. So is the vaccine going to do anything? It is expected no.
Also, one more thing is pregnant people, they fall under like a higher risk category for COVID infection and also complications from it. So they should take it.
I see. Okay. All right. So I think right now looks like any more questions from anybody, you can put it up in the chat window. So any idea on potentially whether in-person schools when probably potentially start next year, or is it you expect it to start before the end of this year, something like that? Because given that children will not be getting the vaccine, so how does it work out?
It looks like if we are going to start this vaccination somewhere April for children, April, May, June, that's the timeline. As it is, we will hit June and then the holidays start.
Children are not getting vaccine though, right?
No, not right now. But maybe if it gets approved for children, it'll be April. They are hoping that by April that study will be ready. So
I see.
If the vaccination starts for children, it's about April is the time, April, May. So if April, May is the time we're expecting, in June we close the schools as it is. So, I mean, I don't think so the school is going to open this session like all Zoom, probably it's going to open somewhere in September, it looks like.
Okay.
And we hope the school opens.
So you also mentioned that parents or visitors from other countries who are here can take the vaccine. They need any kind of insurance?
Nothing. I went on the site as we were sitting here. I went on the site mass.gov/covid-vax. It is very clearly written free. No questions will be asked. You just have to be in Massachusetts.
All right. Okay. So as long as you're here, you go and get the vaccine.
Yeah, go on that site and see. And 75 and above, do go and get it.
Okay. And if some people who are here and got COVID, does typically the insurance cover, or we don't know much about that?
You mean the parents who were visiting and they got
Right.
COVID infection?
Right.
And if they needed hospitalization?
Right.
I don't know how
That
it
depend,
works.
I guess.
But if God forbid anybody gets the severe reactions or the severe symptoms, go to the hospital. I believe sometimes I have heard, cases are thrown into charity also. Like the hospital starts the billing process, your name and address, everything is there.
Mm-hmm.
And basically people just don't pay and they don't pay and they don't pay. Like say I'm responsible for my parent, and people just opt out, they don't pay. I don't know what happens in that case, but I have seen sometimes cases. I have known somebody, they met with accident in Florida. I said, just go to the hospital, you have to get your arm treated. And they fixed the arm for the person, and the bill was never given, and they just said we were visitors to the country. So I don't know how this billing works. Billing is a big mess actually. Yeah.
So Suresh,
and it varies state by state. I think at New York City hospitals, it's free care. You can apply the Mass Health and Medicaid. I'm not sure about the Massachusetts. I think you get a bill.
I see. Okay. All right. Okay.
Well,
yes, Sumanji. I think we are.
But if
go ahead.
somebody falls sick, still go to the hospital. Don't hesitate. At least, first take your treatment part and then the bill part will be handled, whatever. But at least go to the hospital. Don't keep your kahin kisi ka dam ghut raha and you stay in the house. It doesn't make sense. Go.
Yeah, absolutely. One thing for sure, no one is going to refuse to provide care based on the insurance. Even if you don't have insurance, they'll take care of you in the hospitals.
All right. Okay.
I think
so looks like all of the people who have taken it are saying, go ahead and take the vaccine. Don't feel shy about it. Go ahead and take the vaccine. Would be good for everybody and for you. It's small pain, but that's okay.
Yeah, and now it's coming to my mind, like some of your visiting parents, you might think, why get them vaccine if kuch ho gaya, to yahan pe hospital jana padega, and then who's going to foot the bills? So now it is coming to my mind, maybe the mind works like that. But so far, no bad reactions have taken place. So get your parents the best vaccine, Moderna is there. They will get Moderna. Go ahead and take it.
Okay.
All right. I'll pass it back to Sumanji now.
Okay. Thank you, Yogesh.
Yes.
And I think we are right on time. Lots of very, very good questions. Thank you all the doctors. I think the insights that you have provided, I'm very sure that people have been listening and they will benefit from it. So, thank you so much for taking time from your very, very busy schedule and providing the awareness, providing the guidance, and we are forever grateful and thankful for the entire frontline workers and the physician community for being so brave and helping everybody and continuing to do your job, So thank you so much. Thank you, Dr. Yogesh Rathi, for being the moderator. Thank you, Bharatji, for managing the technicalities. Audience, I hope, I'm very sure you found it very, very beneficial. If you have more questions that you could not think of, or you still want to know,
then, please leave them in the chat window. We will figure out a way to get you the responses, or I will put in my email address as well. And if you think about it, you can email us the questions, and we'll get in touch with you and get you the answers. So with that, we will be closing the session, and thank you, everybody. Good evening. Namaste.
Thank you so much for having us. Thank you.
Namaste.
Thank you so much for all
Thank you very much.
words.